Appreciate that. We're going to light and shade as always on this programme, and I don't want to create uncertainty, and I don't want to scare anybody, but we're going to talk about a serious topic now. We're going to talk about a topic that actually a cancer that claims more lives than testicular or cervical cancer, and in fact we're going to talk about mouth cancer. Chris Branfield is from Castle Park Dental Care in Cottingham in the studio this morning. Chris, nice to see you again. You're a Hull City fan, actually. You'll know Needlers, same family.
I really don't know. It's before my time is all that, to be honest.
All right, I know it's gone. I've got a mental block on it. You're not in here to talk about that. Tell us about mouth cancer. It's not something you hear much about, but I'm told it claims more lives than testicular or cervical cancer.
It is combined. It is the Dental Health Foundation. Mouth Cancer Action Month is November.
Right.
And really what we're trying to do is raise awareness. It is a cancer that, if detected early, is a very good survival rate, up 90%. But if it tends to present late because it's not checked out, so you're looking at 5-year survival rates which haven't improved in the last 30 years of just 50%.
Right, okay. So why is that? Why is there not more awareness about it? Why are people not doing more about it, and those that could educate us about it?
I really don't know. As a dental health professional, we do advise coming out. I write a column in the Cottingham Times every now and again. I do bring that up and say, going to your dentist isn't just about your teeth, and it's about checking the bits in your mouth that you can't see yourself for mouth cancer. And that means a visual inspection with light. I use magnification, white light, and also a new device, a fluorescence test that picks up lesions, areas in the mouth that look a little bit suspicious. It isn't a fail-safe, but it's another level of detection. Is it lifestyle related? Yes. Right. In what way? Definitely. All the studies show there's a high. You're 3 times more likely to get mouth cancer if you smoke. Right. You're just under 3 times more likely if you drink. And there is a sort of the effects are greater than the sum of the parts. That when I qualified, it says you're 12 times more likely to develop mouth cancer if you smoke and drink. But I've just read recently that if you actually smoke while you're drinking, you absorb more of the toxins and you're 30 times more likely. The other thing as well is if you've got a poor diet, and there's one study out of Harvard and Columbia University 2 years ago that showed that if a lack of folic acid, so really if you're looking at fresh fruit and veg, healthy lifestyle on that count. So then you look at where the pockets are, and you're looking at the lower, I don't know if you can say this PC-wise, lower socio-economic class deprived areas tend to have a higher incidence as well. I'm listening to you thinking in this area, do we have a high incidence? Because we've got a lot of smokers and drinkers, we've got people on poor diets. I'm thinking myself, I don't smoke to be perfect, but I do drink, and I've got a poor diet. Yeah, well, I was speaking to my colleagues at Hull Royal Infirmary. We've got a fantastic team there. I'm a former chairman and a BDA committee member on the local section, and we organised a study day for dentists throughout Yorkshire. And what a fantastic team we've got here, and the team we've got at Hull Royal do see people from as far out as Cleethorpes and up to Middlesbrough, as far as that. And I asked for the stats and said, well, I can't give you the stats, but Martin said he sees 75 new cases a year. Of those, 40% will go to proper big surgery. I mean, this is a debilitating disease, and the consequences of surgery, we can lose half your face. But these guys are really caring, very, very skilled people, and he said anecdotally he tends to feel that he gets a disproportionate number from South Bank. Right. What, the Grimsby sort of? Grimsby, Cleethorpes. Right. Area. And yeah, definitely in this part of the world, we aren't the highest, but we're up there in the country. So do we not do routine checking then? Or is this, whenever anybody goes to a dentist, is this part of a routine check? It's certainly part of the Castle Park 7-step examination. We look on the outside, we feel the glands, so looking at saliva glands. But what about NHS? If you go to an NHS dentist, is it part of the routine check? I would hope so. I don't go to an NHS dentist, so I don't know, but it should be, and that's why with these study days, this is what we're trying to promote and educate my fellow colleagues. It should be part of that. Certainly when I did my NHS, when I did my 17 years within the NHS, I used to do it. That's what you're taught as graduates, but you need time to do it. We certainly do it, and I would, like I say, as running these courses for dentists, this is what we're trying to not just promote to the public, but promote to a profession.
All right. I'm astounded that it claims more lives than testicular and cervical cancer put together.
That's what I've read.
All
yeah,
right.
those are the stats that I've read. Yeah, it's a more prevalent disease.
Okay. Well, thank you for bringing it to our attention. We won't let anybody. We won't worry too many people. How do people check?
First and foremost, get your dental health. You need regular checks. But the other thing is, if you've got an ulcer that's not healing up after 3 weeks, or you've got some red bobbly patches that just aren't healing up, constant soreness in your mouth, get it checked out. You've got to get it checked out, and then the only way really of diagnosis is to see a specialist in the end, but you need to go through that pathway. Okay, Chris, thank you very much for your time. Chris Branfield from the Castle Park Dental Care Practice in Cottingham. Don't want to scare anybody this morning. Do you want some sweets, by the way, Chris? Are dentists allowed sweets? We've got some needless sweets, I think. James Pykos has brought some in. Are you allowed? I'm allowed. If you have a cup of tea or the sweet, that's fine. Right, OK. We'll talk to James in a minute. We'll have this from them. Here comes...